Welcome back to Ophthalmology for undergraduates and postgraduate beginners. Treatment has to be written at the end of any case presentation. What is the treatment? Over several years, trials have been done to arrive at proper treatment for each diseases. That is called as protocols. Any person who is doing medicine and any doctor should follow the protocols or standard textbooks for treating the patient. The protocols should have what drugs to be used, how much duration it has to be used. So that thing we have to particularly follow. We cannot give drugs that are not in the protocols. We cannot use drugs for a shorter period than what is recommended. So by doing that way, we can avoid litigations. Today is a consumer world. Every patient is filing case against doctors for improper treatment given. If we had followed the protocol strictly, then nobody can find fault with the doctor so that we can save our head. Do not write drugs for commercial benefits. Whatever drugs that has to be used according to the protocol only should be used. We should not write drugs just because it will earn us some money. Avoid unwanted use of antibiotics. Antibiotics used should be used in recommended full dose and full duration. Why we should follow this protocols? Because the number of antibiotics in this world are very limited. If we give unnecessary antibiotics to the patient or we reduce the duration of antibiotics and dosage of antibiotics given to the patient, what will happen? The bacteria and microorganisms may go in for antibiotic resistance. In order to prevent that resistance, we have to follow these two. While writing the treatment, we have to write clearly the name of the drug, dosage of the drug, how frequently the patient has to take. Whether it is once a day, twice a day, thrice a day, 4 times a day, whatever it is, we have to write it clearly. We should also write whether the drug has to be taken before food or after food. Route of administration should also be mentioned in the treatment, whether it is oral, IV, IM or any other mode of route of administration. We have to write it clearly. Avoid drugs to which the patient is allergic to. If the patient is already allergic to any particular drug, we have to avoid writing that. We should not do the mistake of writing the same drug again. The patient may land up in allergy and side effects which may lead to morbidity and mortality to the patient. Follow up and review to be written and communicated clearly to the patient. Just because you have written a treatment and given to the patient, we cannot stop there. We have to ask the patient to come at regular intervals to look for what is the improvement that has happened to the patient with the drugs you have given. Then, according to that, we may be able to modify the treatment given to the patient. Last but not the least, it is better to start treatment in the morning. Unless it is very essential to start a treatment immediately as an emergency. If the patient is not in the hospital, I always ask the patient to take the drugs from the mornings. Why I am doing that? Because sometimes a new drug you may be writing to the patient may cause side effects or allergy to the patient. If the patient starts taking late night, what will happen? If the patient gets allergy to the particular drug or side effects to the drug, it is very, very difficult for the patient in the midnight to approach a doctor or a hospital for management of allergy and side effects. Unless it is very, very essential to start the treatment immediately to save the patient or to bring the disease immediately under control, it is better to start drugs from the morning. With this, we'll stop. We will discuss about another topic in another video soon. Thank you.